Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Ferris here with us this morning, and Ferris came all the way down here from Chicago, Illinois to see us, and he's seen a chiropractor up there in northern Chicago, and he's been getting adjusted for how many years?
2 years.
2 years now. But his friend, what's your friend's name?
Son M.
Son M. So this video's for you, Son M. And all you other Chicago lights there.
Yes, indeed.
All right, now let's have you close your eyes for me and bend your head forward and backwards for me, Ferris. I've already done his orthopedic neurological exam. Then backwards. And then neutral. So he has a job where he's at a computer a lot, and you can see his head's forward, his ears dropping right out here. His head's also translated to the left on the x-axis, but his head's rotated to the right, so he sleeps on his side with his head turned that way all the time. And down here, his pelvis is closer to this left hand than it is over here on the right side. So that indicates his pelvis and sacroiliac joints have subluxated, along with his lumbar spine. So I'm going to have you lay on your tummy again. And we're going to put your face right down in here. Now his right leg's short by over ½ an inch. And when I bring it up, it gets even. That tightens up in his low back and pelvis there, and his thighs as well. So he's got left and right SI joint subluxations. He's got L4 and L5 subluxated posteriorly, retrolisthesis. He's got T10, 11, and 12, and L1 subluxated right where that thoracic spine curve changes into the lumbar spine curve. That's tender right there, isn't it? And that's tender right there, big time. He's got T5, 6, and 7 anterior. He's got C6 and 7 on the right. C3 and 4 is also on the right. Now, I'm going to show you something that's interesting here. I'm going to have you lock that right leg straight, lift that whole right leg off the table. Okay, now that's as far as that one can go. Relax that one. Do the same thing on this left side now. And you see how much higher he went on this left side, so you can relax that one now. So that tells me he's got a sacral deviation on the right side here, posteriorly, which is why he could not lift his right leg up as high as he did his left leg. So I'm going to begin his adjustments with a sacroiliac adjustment on that right side. I'm adjusting it PIIN. That's a Gonstead listing. Also Thompson technique. And I use the BioPhysics adjustments on everybody. Which BioPhysics just is really the biology of physics. Nothing more complicated than that. We use the X, Y, and Z axes to determine the coordinates of his subluxation pattern in his biomechanical configuration. There we go. So I adjusted his sacrum and his deviation there. His legs are exactly even now, and I bet you, Ferris, this feels smoother to you this time than the first one did.
Yes, sir.
Already. I haven't even really got up in the lumbar spine yet. There's L5. L4. L3. Now I'm going to save this one for the knee chest table. Okay, just keep breathing. Boy, tight in there. Okay, just let your head relax. You're going to feel it popping up a little bit. Slide down this way a little bit, please, sir. Good. Okay, let's turn you on your back now, please. See, I'm bringing his head up and backwards on the x-axis and the Z-axis as well. There we go. Now slide down this way a little bit.
Down?
Just straight down, yeah. I don't ever want you sitting straight up.
Good.
No, go back up that way a little bit, please. There you go. Now put your arms out to the sides, palms facing up. Put your hands on your tummy. There you go.
Yes.
Should have felt that in your knee all the way up to your low back.
Yes, sir.
Same here. Oh yeah, good job. Okay, let's set you up face toward Joseph. There we go. Keep your chin up, remember? And just relax this. Perfect. Yep. Crack addict's gonna love you, he knows you all over. Wait till I get you on that knee chest. Have you ever been adjusted on a knee chest table before? Like that right there?
Similar.
Similar?
Actually, no.
I was gonna say there's really nothing similar to a knee chest table except the knee chest table.
The knee chest table, there you go. It's the first time for everything.
That's it. First time for you, not for me. Not my first rodeo. Come on over here.
All right.
Now, I'm going to have you get on your knees right there. Put your face up in here and rest your chest on the headpiece here. Go ahead and slide down just a little bit. There you go. You kind of let your back just sink down into this.
Like this?
Yeah, just let this gravity sink down in here. Oh yeah.
Oh yeah.
Very good. That was right at the thoracolumbar junction. Now let's come over here. And we're going to have you lay on your back on this table with your pelvis there and head up here. Okay. So Ferris was telling me that he had a chiropractor up in Schaumburg, slide up just a little bit where your pelvis is right underneath that used to pull on his neck with a towel that helped him, but he's no longer practicing.
Yes, that's correct.
So you haven't been adjusted in how many years?
I'd say roughly 1 year.
A year? Yeah. Just let your legs bend and relax naturally. Put your hands on your tummy. There you go. Now I'm going to have you lift your head up for a second. Lay it right on back down. Now, just breathe through your nose. Relax. Oh yeah.
Oh yeah.
You should have felt that all the way down, Ferris.
Yes, sir.
Good. Alright, drop this in my hand. Oh yeah. Boy, doesn't get any better than that.
Yes, sir. Perfect test case.
Oh, you're not a test case. The girlfriends I used to adjust in chiropractic college were the test cases.
Alright, sir.
Now let's have you stand up and face the mirror. Okay, now I'm going to have you flex your head forward and then backwards. And then back to normal. Yep. Okay, so now I'm going to shoot you. Come all the way from Chicago to Houston. Got to shoot you. Pull these shoulders up and back like this. This is your homework, by the way.
Okay.
So your head's forward to the left, so we're going to come straight back to the right. Now look up the wall behind you. More extension. A lot more. You got to look at the wall behind you. Perfect. You feel that all the way down your low back, right?
Yes.
Okay, now relax. Now, when you go forward and backwards again, tell me if this feels any different to you.
Okay.
A lot better range of motion.
Yes.
Now look how straight you're standing up right now, and look at the equal spacing you have now on the sides compared to before.
Agreed.
Shoulders are squared off.
Yes, sir.
So how do you feel right now? You hurt anywhere?
No, sir.
Okay.
Feeling good.
Good. So how would you relate to our YouTube fans about your very first experience here at Advanced Chiropractic Relief?
So, I've been a YouTube viewer for about 2-3 months, and getting the ring dinger and getting Mr. Johnson's expert advice and his performance, I can't even speak. It feels great. I think anyone and everyone who needs to have relief needs to come and see Dr. Johnson.
Well, thank you very much. I appreciate you sharing your story with everybody.
Of course.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.